Hello, my name is Brittany Bennett, and I will be going over the left lateral decubitist chest. Patient preparation. Confirm the patient's identity in 3 ways: wristband or paperwork, and asking the patient to state their name and date of birth. If female, confirm last menstrual cycle date. Confirm with the patient what we are imaging to confirm that the order is correct before imaging the patient. Make sure to shield the patient with the appropriate lead shield if necessary. Make sure to remove all jewelry, metal, in the area of interest. Ask the patient to remove the undergarments in the area of interest. The IR size is 14 by 17. The IR orientation is landscape. The IR location will be wall bucky or tabletop. However, the wall bucky is easier if the patient is on the stretcher. SID is 72 inches. Patient position. Patient is recumbent and laying on top of the radiolucent pad on their left side facing away from the IR. Back is against the IR and the patient's arms are above the head. The pillow underneath the patient's head for support, and the stretcher is locked in place. Part position. Adjust patient so that the cart and the patient's mid-sagittal plane and T7 is centered to the IR. CR location. CR is horizontal and centered to the level of T7, which is 3 to 4 inches inferior to the level of the jugular notch. CR angulation. We do not have any type of angulation on the tube. Collimated field size. We will have open collimation to ensure to have the apices, entire lungs, and the costophrenic angles. So it will be 14 by 17. Visual of appropriate marker location. The marker is located behind the patient's shoulder, and it is the right marker that is marking it. KVP range for a real patient is usually around 110 to 125 KVP. Instructions to the patient. For exposure, ask the patient to take a big, deep breath in and blow it all the way out. Take in another breath and hold it. Take the image on the full inspiration. Anatomy demonstrated. The entire lungs, apices, and the costophrenic angles include the lateral border of the ribs. The vertebrae should be having an equal distance on both sides of the lateral border of the ribs and the sternoclavicular joints. Faint visualization of the vertebrae and ribs through the heart shadow. Items in profile are not located. Pathology best demonstrated in clinical indications. You will be able to locate the pleural effusions demonstrated as air fluid levels in the pleural space. You can also locate possible pneumothorax if there is any small amounts of air in the pleural cavity. You will also be able to locate the left lung, right lung, and as you can see, there is a balloon resembling fluid buildup. It is also showing the body is laying on the left side. There is the heart, hilar lung markings, costophrenic angles, left and right clavicle, diaphragm, and the first rib. And that'll be it. Thank you so much for your time.